In this video, we'll be discussing ADHD, what it is, what it looks like, and what we can do about it. So you hopefully already know that this stands for attention, deficit, hyperactivity, disorder. We used to have two separate ones. We had ADD and then we had ADHD. When the DSM-5 came out, this went away and just became a subtype of ADHD. So everybody now has the ADHD diagnosis, and then you can have the inattentive type, the hyperactive type, or the combined type. So there are 3 core symptoms of ADHD, and in order to be diagnosed with ADHD, these symptoms need to be present both at home and at school. If they're present only in one situation, it looks more like a behavioral issue rather than true ADHD. Here are your 3 core symptoms. Number 1, inattention. Number 2, hyperactivity. And number 3, impulsivity. So, inattention would be sitting in class and you're supposed to be learning about Mark Twain's book Thomas Sawyer, but instead you're really busy thinking about the party you're going to have this weekend. To the point where students will not hear homework assignments, not hear directions. At home, kids will lose toys, they don't know where they left things. In adults, we'll see losing keys, losing cell phones. So you lose things, you forget things, you can't hear things because you're paying attention to something else instead. Number 2, hyperactivity is pretty straightforward. It's really hard for a hyperactive person to sit still. So in school, we see that the child is constantly getting up and moving around the room. We can also see it with speech, where someone may talk excessively and quickly. It almost sounds like pressured speech, like you might see in someone with bipolar disorder. Then number 3 there, impulsivity. This sort of relates to the hyperactivity, that the kids, if they have an impulse to do something, they can't repress that impulse. So an impulse to jump up out of their chair, why not? Let's do it. An impulse to interrupt the teacher while the teacher is talking, of course, why wouldn't you? So a lot of interrupting, a lot of strange behaviors that don't seem to make sense to other people. This can also lead to a lot of risk-taking behaviors in our adolescents. Speaking of risk-taking behaviors, we do know that people with ADHD do have a higher risk for depression and anxiety, for poor school performance, for injury or accident, and for substance abuse. So the poor school performance, the injury, the accident is related directly to the disease. The higher risk of substance abuse is usually self-medication. They learn that whatever the substance is helps them feel better, helps them do better, and so they continue to take that and abuse that and often end up in an addiction situation. There is also the issue of the addictive nature of ADHD medications, but we'll talk about that in a second when we talk specifically about the medications. For treatment of ADHD, we really do need a multidisciplinary approach. A lot of people think first and only of medications, but this is a multifaceted disorder and so needs a more holistic approach to treatment. So first we actually need to think about therapy for the family and specifically for the child. The child needs emotional support, self-esteem, some coping mechanisms, but the family in general has a pattern of the child misbehaves and the parents punish, the parents get angry. So with that pattern in place, it's really hard for the child to ever succeed at anything. So the family needs some help creating new patterns and breaking old habits. We also need to talk about school interventions. This can be simple things like putting the child towards the front of the classroom so there are fewer distractions, allowing the child to use an exercise ball as a chair or to have a rubber band across the bottom of their chair to provide for that constant need for movement. allowing the child to take quick breaks to run the attendance down to the principal's office, or any of those small chores that a teacher can come up with in school. The child may also need some assistance with keeping a planner, organizing assignments so that they are not losing track of due dates. Most importantly at school, though, and at home, is physical activity. We do have a fair amount of research that demonstrates that with increased physical activity, symptoms and need for medication of ADHD are both decreased. So increase that activity and your need for meds goes down. Unfortunately, what we're seeing at a lot of schools is that they are actually decreasing the amount of recess that children have each day. So that is really especially hurting those students with ADHD, although it's not particularly great for any of the students in that school building. Okay, finally, we do need meds. They can be very helpful if used appropriately and in the right situations. So the most common course of medications are your stimulants. This includes medications like the amphetamines, methamphetamine, or methylphenidate. So the brand names you may be familiar with are Adderall or Concerta or Ritalin. It seems counterintuitive that a stimulant would help to calm someone down, but what it actually does is increase your brain's ability to focus and to increase the function of the frontal lobe, which increases your impulse control as well. Now, if those medications alone are not working for a patient, then we do sometimes use other behavioral meds, psych meds, or sometimes sedatives as well. So we are starting to see new medications like guanfacine. Let me spell that for you. Or atomoxetine. And these work more like anxiety meds or depression meds, where they're actually changing the chemical balance in the brain. So we'll see these usually as an adjunct where they're working with the stimulant, although in some patients we do see them alone. Finally, we do sometimes see clonidine. In higher doses, it can actually be used as a blood pressure medication for adults. In ADHD, what we're actually using it for is a mild sedative for bedtime. If the stimulants are making it hard for the child to sleep, then the clonidine can help. Speaking of difficulty sleeping, we do need to be aware of the side effects of these medications. An important side effect with the stimulants especially is lack of appetite. So in this time when our children are supposed to be growing and getting stronger and bigger, if they're not eating anything, we really can have a failure to thrive picture. There's also a small chance of cardiovascular complications or even compulsive behaviors, anxiety, so we do need to be aware of that as well. Many psychiatrists advise taking some kind of medication vacation on a regular basis to ensure that the medication really is helping the child and to ensure that the side effects are obvious. So many children will take the summer off just so that the parents can actually see how the child does without the medications to evaluate whether they're really necessary and to allow that child to have at least a few months of the year where they really are growing and developing naturally. What we don't recommend is taking weekends or short breaks off because it does take several weeks for the body to sort of adjust to the medication. Although we do have college students who will choose to only take their medication, say during finals week or during midterms week, because that really is the only time of year that they feel they require the help of the medication. To wrap things up, why don't we try a quick practice question? Read the question, pause the video for a second, and when you're ready to see the answer, hit play again. A child who is impulsive and can't control those impulses will interrupt people and ignore the normal rules of etiquette and politeness.